If you've been on this earth for any appreciable amount of time, you likely know a lot of people who suffer from significant knee pain. As a physical therapist, I get to see these people all day, every single day, because knee pain is one of the more common complaints that we see. I've seen people before knee replacement surgery, I've seen people after knee replacement surgery. Either way, they tend to present with the same characteristics. Now, these two characteristics that we're going to talk about are what I believe to be the primary cause of knee degeneration as we age. The first one is weakness of the hip abductors. Now, hip abduction is simply a fancy way to describe lifting the leg to the side. So this is shoulder abduction. You can imagine what hip abduction is. When this muscle is weak, what will happen is the knees will move together with any sort of dynamic activity, such as a squat. Now, when this happens, it changes how the patella moves. So normally it should be more or less up and down in a vertical direction. When you have the knee going in, it adds a little bit of curvature to the motion of the kneecap. Now, what this does is it will slowly break down the knee over time because it's not designed to handle stress in this position. The second characteristic that we always see is tightness of either the calf or the ankle joint itself. Now, a good way to test this on yourself is to see if you can squat all the way down to the ground, keeping your heels flat on the ground, and then not doing what's called pronation of the feet, where the feet roll inward. When the feet do roll inward, this is the body's natural compensation when you have a tight ankle. In this position, not only can it affect the foot in adverse ways, but it'll again pull the knees together in that same position we talked about with the hip muscle. Now, that position is called knee valgus. So how do we help prevent that? We have to strengthen the hip, and then we have to improve our ankle mobility. Now, if you're one of those people who doesn't do a lot of squatting, you might wonder why this matters. It matters because even though you don't do squats in the context of the gym, you still do a lot of squats in everyday life. If you stand up and sit down, you're doing squats. If you're going up and down stairs, you're doing squats. It's kind of like a single leg mini squat, but it is a squat nonetheless. So to strengthen hip abduction, I think the best way to do this is with what's called a lateral band walk. To do this, just place a loop band around your legs. The farther down you go, the harder it is. I like to put this on the feet, and then you're going to step to the side. Make sure you keep tension on the band the whole time. Something else to keep in mind is that if you let your feet turn out at all, you are now biasing the wrong muscle. We have to keep the feet parallel or even turn the toes in just a little bit so that we make sure we are targeting the correct muscle, which is called the gluteus medius. Now, in order to stretch the calf, a lot of people like to just stretch the calf with the knee straight off of a stair or against the wall, but this only accounts for one of the muscles in the calf. If you're not stretching the calf with the knee bent, you're not stretching the soleus muscle, which is often the culprit, especially when it comes to lacking depth with the squat. So in order to stretch this, I like to get on a step, put all of my weight on one side, and then bend my knee a little bit. You should feel a stretch through the calf. You might feel it in the ankle joint itself, which is fine. And then you can even add a little bit of a bounce up and down to get additional stretch. Now, in order to actually improve this significantly, we have to stretch all the time. So I'm talking several minutes at a time, several times a day. The more you do it, the more flexible you will become. So I hope you found that helpful. Those are essentially what I believe to be the two most important characteristics or things we can improve before the knee starts to break down. And that way, hopefully, we can help you prevent getting a knee replacement in the future.